Is Queens over on east? Is it north of Brooklyn?
I have no idea.
Shoot, what is it? Oh man, yeah. Anyways, sorry for the people that live in New York. They're just like, shit. Hey everybody, this is Dr. Warren here, Kalkstein Chiropractic with Marjorie, and you and I met at the YMCA turkey trot here in Towson.
Yeah.
And your son was there with you, and it was all about your son then, and he was dealing with some kind of pretty regular headaches, migraines, and we talked a little bit about chiropractic care as it relates to treating those type of things, as well as being mindful about all the different angles we need to play for kids that are dealing with chronic migraines. And you are well familiar with that field, if you will, in neurology and having co-management from different specialties. And so I definitely think Caroline might be a good resource internally. So we have a nurse practitioner who's a little more functional med primary care that's in-house, but has a history and practice in emergency room medicine as well as in primary care settings. So it might be a good kind of talking point with Dr. Angie, who's taking care of him, to use Caroline as well.
Okay, great.
Okay. And so you didn't even say anything that you were dealing with anything when I first met you.
Right.
Let me say that a little bit better. She didn't bring up any problems with me. It's all about her son during the visit. And then, yeah, I saw you in the waiting room and I was like, hey, good to see you again. And it was your appointment, right?
Yes.
So tell me a little bit about kind of what brought you in and then what your experience has like been so far as it relates to your problems that you brought in.
Yeah, so I had I feel like a lot of overuse in my body. I had a very physical career, and
You still do.
and I still do.
Yeah.
As a nurse. So when we saw you at the YMCA clinic, I just liked your approach, their holistic approach, with incorporating physical therapy and exercise. So I came in because I've had lower back pain and neck pain for quite some time, probably 20 years, and it was just getting more frequent and constant now that I'm getting older. So I was just happy to be able to come in, and I'm already seeing improvements in just a couple weeks. So
Nice.
and better mobility, posture correction has been really helpful.
I'm glad you're getting good results early on. Like intention is that right there. Relative to it, and she spoke about like holistic care, and we see it as combining conservative care as a whole, and not putting ourselves in a camp and being open-minded, as well as setting up an environment to be really conducive for patient needs. So that looks like she gets chiropractic care here. She gets dry needling periodically. We haven't utilized shockwave with her, but she's incorporating advanced physical therapy with us to the point where we're kind of leaning into some strength training with her as well. We diagnosed on the front end accurately a lower back and potentially some discogenic pain that had subsided, but she was still limited in the way she moved in her lower back. She had a history of a problem in that area that we really didn't fully understand until we examined it and saw that there was still some functional changes in the way she moved from one side to the other. So you had some positive neural tension on that right side of her lower back, as well as some changes in the way she moved with her lower back. So we were able to address that, and it's starting to show early on as it relates, not just because she feels better, because she's moving better. And so that's kind of like a summary of where she was. She deals with some more chronic, like shoulder, upper back tension and pain. So I'm going to speak to two kind of maybe topics that people come in here with that have a lot of questions relative to structural changes in the spine, okay, versus functional. So a lot of people have structural differences. I have structural differences in my spine, right? So I can relate to this to both sides of the coin, understanding that I have it as well as perceptions that people have about it. And I always come back to some of the famous people that have, athletes that have structural shifts or changes in the spine. So if there's any deviation or rotation in the spine itself, so Usain Bolt has that, right? Like there's elite level athletes that move really well that structurally are not normal, okay? I wouldn't say I'm an elite level athlete, but I'm structurally not normal for sure. I have something called facet tropism, and so my facets don't align in a similar manner. There's one that's like this, and one that might be like this for an exaggerated purpose, okay, in my lower back. Understanding what that can do over time as it relates to where we hold patterns of stress is where I come in, and then reinforcing that good movement that we're going to do in that area. All right, so in a nutshell, I just talked about like kind of congenital things that we are naturally born with or that we develop over time, abnormalities that would show up on imaging, like scoliosis, and then where we might have patterns of stress because of them, and then how I approach it here, right? Scoliosis is a big, broad topic as it relates to that, but deviations and slight rotations can show up minorly. You might not even know you had it your whole life, right? So that's one component, right? And then the other thing that she didn't even bring up, but we talked about early on, right, was, and we addressed like, do you have any major concerns, any fears coming in, or any like past kind of reservations? And we talked about VAD, vertebral artery dissection, right? And it's commonly approached as it relates to like a concern or fear about neck manipulation, right? And so in medicine, there's risk with everything that we do, okay? And so when people come in and see me and they have a raging migraine, neck pain, and it's insidious onset, I'm just like, whoa, wait a minute. So there's a lot of things that we have to pick up on the front end and it relates to history. Okay, that's the biggest filter that I have coming in is making sure I have a good idea of what I'm dealing with, okay? And then orthopedically assessing and looking at the neck and really putting them in a category of whether they're safe or not safe to adjust in that area, okay? And then there's a third step to that as well as it relates to it, and that is my application of force over an area that's not moving well, okay? So I'm not just like winging it when it comes to working on someone's neck, okay? And I think that applying the right technique and applying the right forces to areas that don't move well, and I've already checked off all those other boxes, I put myself in the best position to treat her well, okay? All right, so those are the three things that I do. And then if you really need more information about that, we talked about this, some of these big systematic reviews of the literature as it relates to that particular problem. If you really look at that stuff, and that's what is driven by the high level MDs that are doing a lot of these amazing research programs like Cochrane Reviews and things of that nature, those are really well done. And what some of the more prolific ones have found that it doesn't even matter if you're seeing a chiropractor or your primary care, and if it's a relationship to neck pain and migraines that is the biggest causative factor, right? Yes. And acute onset. So when people come in like that and they did these studies, and you're more likely to have a vertebral artery dissection after seeing your primary care than the chiropractor. The primary care is not manipulating your neck, but what that study showed that there was that it's not a it most likely is not a causative relationship of the manipulation. It's the person that's in that pain, okay? Even though that is obviously a very intense movement on the neck, right? But when done right, when done to the right person, and when done well with the right application, it's a safe modality for neck pain, okay? So I'll attach that review, I'll attach some of those talking points. It's a hot topic, and I don't talk about it a lot because it's just heavy, but it's an important thing to understand for sure for you and for other practitioners to really have a good understanding of, like, what are those factors that people look at that make you an increased likelihood of having a stroke, right, or a dissection. So hypermobility disorders are one thing for sure. A history of smoking is another one. They've looked at hormonal drugs as well as being a component to it, and then age, gender as well, females. So there's a lot of components that you look at that categorize patients in that population, in addition to all the other things I just said. So I hope that helps you understand it. And sorry for digressing so much on your treatment here today. And she came in, she's like, I just worked like 4 days, 18 hours. And I was like, oh, do you mind if I burden you with doing a video real quick? Your one time.
Let's do it. We like it.
Appreciate
we like
you. Thank you. I appreciate that support. And she came from, you were in shock trauma? Where'd you work before?
I worked in neurosurgery, neurology, and a stroke unit for a long time, 13 years.
There you go.
Yeah.
So she comes from that background, right? And I appreciate her just like bringing it up front with me and just being real.
Yeah.
And then also just having the patients to kind of hear my side of it relative to that. So, but for right now, let's focus on taking care of her. Okay? Yeah. You can stand on up. You're gonna sit right here, facing this way for me. When was the first concert you ever went to?
Oh, yeah, that was Roger Waters. Roger Waters at Nissan Pavilion.
Roger Waters, what kind of music?
Like Pink Floyd.
Oh, really?
Yeah.
Play. Hey Alexa, play Roger Waters playlist on Spotify. Eastside Pavilion?
Nissan down in
Nissan.
like Fairfax area.
Oh, I've never
Fair
been.
Oaks. Oh, it's a great venue.
I'm going down to DC for a show on Friday.
Oh yeah, what are you seeing?
A band called Camp.
Okay.
It's a little more chill, like in the summer, relaxing music.
Nice.
And it's my brother-in-law introduced me to it. It's like late music.
Okay.
So it'll be, I don't usually see this kind of band in person, but I'm excited to go. Have you been to the Anthem on the Wharf in
No,
DC?
I have not.
It's a cool spot. Cool area. DC's awesome. Bring your head back for me. And bring your head down. Head back. Head down. Get your hair out of there. Head back. And head down. All the way, go. Head back for me. And head down. No, you're good. Is this a cover?
I don't know. It's something, maybe a cover. Roger Waters is the same one. The singer.
Oh my gosh. So it's him. This is Pink Floyd. Yeah. I've seen him twice, a cover that is,
Oh yeah.
in St. Louis.
There are a lot of good cover bands. There's a lot of like good Led Zeppelin cover bands.
Mm-hmm. Pink Floyd, Led Zeppelin. Reach up. You relax your left arm, you're good. Reach up. Good. Nice. Good, now cross your body again. Is that it?
Yeah.
Tuck your chin, turn to your left. Head down. Turn your body to the left. Nice. Relax. I'm going to rotate you and adjust your right upper mid back. Elbows together, hands on your cheeks. You okay right there? Okay, I'm going to turn you and create force up into that space. Rest. Nice. And then relax. Go ahead and stand up for me. Awesome. And then I'm going to bring this table up, okay? Yeah, good. And then I'm seeing Leon Bridges. Oh, he's got a smooth voice. It's kind of eclectic, but R&B. Line your stomach for me. Seeing him in the summer.
Nice.
Yeah. I don't know, I was playing.
My daughter's trying to convince me to take her to a Korean band.
K-pop?
Yes.
Hell yeah, K-pop.
Oh gosh.
That's gonna be a lit show. It's gonna be so much fun. Are you gonna go?
I don't know yet.
Yeah, you're so gonna go. Good. Nice. Now you can breathe again. So where are you taking her to see that?
She wants to do it up in New York, in Queens.
In Queens?
Yeah.
In Queens?
Yep.
It's funny. We were in Manhattan a couple weeks ago. I love New York City, and what a cool place. And they were telling me not to go up towards Queens, but I don't know Queens like that.
Yep, I don't know it at all.
Is Queens over on east? Is it north of Brooklyn?
I have no idea.
Shoot, what is it? Oh man, yeah. Anyways, sorry for the people that live in New York. They're just like, shit.
I'm not trying to give out any free judo lessons.
I hear you. I hear you. Take a deep breath. Easy. Don't worry, wherever you're going, you will be outnumbering everybody else. That is for sure with the K-pop show. Strength in numbers in those organizations. I used to go to concerts and treat artists before they'd play.
Oh, cool.
It was before children. Before there was like, before I chose to have my free time and doing stuff like that. I should say that. Because I choose
There you go.
my free time to be with my kid right now.
Happy with belated Father's Day.
Cheers. Thanks. It was a great one. I sat on my back porch. I ate blue crabs with my dad, my Uncle Mike. So two good talkers, you know. I just sat there and ate. And my middle one came over and just smashed crabs with a hammer in front of me. Solid start to her crab career at 2.
Nice.
That was good. You okay here?
Yeah.
Alright, good. Alright, you moving well. Just a little release here. Okay, lie you on your right side. Take your time getting there, your left side up. We got you. Press your hands. A little stretch, easy release here. There you go. Good, a little bit more pressure. That's fine. Okay, come on your back. Lie on your left side, face that way. I actually, I like to cook, so I was like, Chris, I'm gonna go to the grocery store to get dinner tonight. She's like, no, I gotta cook for you. I'm like, no, I'm gonna make the most epic meal. And I had a great Alfredo pasta on the side. I got some steak. That was it. It was fantastic.
Okay.
That and crabs as an appetizer. I was like, I'm set. Nice. Okay, good. Some gentle traction on your neck, okay? Put your head up for me and rest it down. Good, easy. Good. Blade adjustment right there, okay? I got you. Relax your jaw. Good. I'm gonna take you from here to here. Good. Traction all the way down. Perfect. I hope you feel that pressure from the last 3 days is gone. We're gonna do a little bit more work. And thanks for watching. Thank you for doing the video with us. I appreciate that. I hope you enjoyed, learned something, or whatever. And take care.
All right, hey everybody, it's Dr. Angie here at Kalkstein Chiropractic. I have Kendra here laying on the table. She's been dealing with some upper trap tightness, just really tense, you know, we work real hard all day. She's doing all the examinations and working on her adjustments and dry needling, and you know, sometimes we gotta take a little care of ourselves too. So we're gonna be working up into her upper traps. You can see that like tight, yeah. Watch that guy roll. Yeah, same thing happened on this side. Left side's not as bad, but we're gonna hit both sides. Also getting a little bit up into her paraspinals, just help to alleviate some of those tissues from overworking. A lot of what we do, as you see, we lean forward a lot, so our shoulders want to round forward. We're gonna get that tension and that pulling up through our neck and into the upper traps. So we're gonna go ahead and treat her. It's a little alcohol swab just to clean the area. Get the long hair out of the way. The luscious locks. All right. I'm gonna start up high here. Yeah, there we go. Awesome. So a lot of questions we get about dry needling. People will be like, well, how many are we going to use? I say it just depends on what we find. Sometimes it's a simple frame. We'll kind of get around the musculature. If we're targeting a specific area, there might be 6 to 8. Other times we're kind of exploring it and we're targeting a bunch of different muscles, targeting the whole band that works into that upper cross syndrome that can happen. So the upper traps, the levator scapes, so working kind of down into where we meet the shoulder blade as well as across the top part of that shoulder. So we're going to start getting into this left shoulder a little bit here. We're going to get bigger ones here for the tissue we're working into. Thicker muscles.
Ooh.
There is a nice little twitch. Nice little jump.
Ooh.
Yeah. And sometimes, like what I'm doing here, we do a little bit of called pistoning. So we'll go in and out of the muscle, kind of keep that, like, get it to relax a little bit deeper. When we get that twitch in the muscle, it tells us we got into that taut fiber. There it is. There it is again. Yeah.
Oh.
You got big ones there.
I'm dancing.
We thought the left side wasn't so bad. How about that? Hey, guess what? Now it's time to hit the right side. I'm going to flip around the other side so I'm not in your way here.
If you need to move my hair, go for it.
Oh, no, you're good.
Ooh.
Yeah, another little sticky guy. But yeah, as we do that pistoning kind of technique, we're getting that taut fiber and that muscle to relax. There's another little one in there. Good. And then, as most of you know, we just kind of let them sit there and rest for 10 minutes with their patient so the muscles relax around it, kind of reflexively getting in there.
Ooh, that was a spicy one.
Yeah. That's the other question we get a lot of times is like, does it hurt? And I'm like, it can sometimes, but the needle itself typically no. But when we get those taut fibers, like we'll get, like she said, a spicy spot that we feel it kind of grab on a little bit. Good. Yeah.
Raise your legs up more.
Good. The matching ones on this side.
Yeah, we're all finished up here.
Last one. Actually, last couple, I should say.
Hey, I'll turn the other way around. I'll put 10 minutes at a time for you there. Maybe.
Ooh, that's a good spot.
Whenever you're ready.
Last one here. Awesome. All right, we're gonna let her sit here for 10. They'll come in and remove those needles for her and she'll be good to go. And then we'll go with a little bit more, whether it's stretching, exercising, and her adjustment for her treatment.
Hey everyone, it's Dr. Kendra at Kalkstein Chiropractic. Today we have Dr. Nick with us.
Hello everybody.
And he's coming in with a little bit of neck pain today. So tell us a little bit about when it started, how it started.
Oh yes. 2 days ago it started. The pillow setup, as I told you earlier, I'm not going to go into too much detail. I have a very specific pillow setup, and I deviated from the standard Sunday night, and I woke up Monday morning and my neck was pretty unhappy with me. Feels very musculature, maybe a little tinge bit of some joint irritation, but for the most part it feels pretty locked up in the muscles.
Okay. All right, to start
That's
off,
my story.
that's his story, everyone.
I'm sticking to it.
Just to start off, we're just gonna look at your range of motion just a little
Okay.
bit. So I'll have you step in front of me, and I'm gonna have you tuck your chin to your chest. How does that feel?
It feels like I have full range, but towards the bottom I get a lot of pulling through the upper cervical spine.
Sure. And extend all the way back.
This it does not feel good with.
Same spot.
Same spot, more like suboccipital region, but also like stretching down from here,
Okay.
kind of back through that region.
Got it. And I'll have you rotate.
Left feels good. Right feels fine as well.
Okay. Good. Go the other way. How do those feel?
Both those feel pretty good.
Okay. I'm gonna have you lay on your back for me. Definitely tight up in here.
Yeah, that's definitely like the problem child is my suboccipitals.
Yeah. I'm gonna bring the table up.
All right, what you thinking?
So you're definitely tight in your suboccipitals. You're moving pretty well. For treatment plan wise, I think you would benefit from just an adjustment today. Just to get you moving. We'll do a little bit of soft tissue work to the muscles surrounding your spine and your cervical spine and to the suboccipitals to loosen you up just a bit.
Cool.
Are you down for that today?
Yeah, I am.
Let's do it.
Which way?
I'm gonna have you on your back again.
Cool.
Cool.
Wow, it's been so long since I've had, I guess you can call it roughly a report of findings.
Really?
Yeah.
This is Dr. Warren's favorite stuff. Hans honey.
I'd say, is it the Huns or is it the Dr. OG?
Well, that's a tie. He likes them both pretty well. So we're just doing a little bit of soft tissue work to loosen up those muscles. I heard my name.
Warren's probably looking for you.
I know, I'm thinking the same thing. But I heard someone talk about my cats. Fun fact, I have 2 cats. Or my children. Now this way.
Sorry, I'm trying not to tense up too much.
You're good. Is the pressure okay?
The pressure was okay. It's just highlighting a lot of tender spots.
Oh yeah.
You never know something hurts until you go and start pressing on it. It's like so annoying.
It's always how it is. So this soft tissue work is just loosening up those muscles to get everything moving again, paired with the adjustment. We'll get everything moving pretty well.
Stretching out my already long neck.
I have a long neck too, it's okay. Maybe it's a chiropractic school thing. We just get our necks stretched out.
Hammered the whole time. Carly, you can't laugh at that. Inside joke.
I'm just like imagining an old chiropractor with a really long neck.
I mean, Dr. Jeff managed to escape it.
Yeah, I was gonna say he doesn't have a long neck.
I wouldn't consider him too old though.
He's not old. You tender there?
Yeah, definitely so.
Stuff is slippery. It is. I'm like slipping.
Nice.
I'm gonna bring the table up and I'm gonna have you flip.
You're trying to say I'm a fall hazard?
Yes. Being that tall. You're so far from the ground. I wouldn't know what that feels like.
Some people get so offended when I bring the table up to make them flip over. I'm like, listen, this is just standard protocol at this point. Like, it's not that I don't trust you, but...
Raise that just a bit so you can relax down. Good.
Oh, that was wonderful. Like butter, Kendra.
Oh yeah. It was that soft tissue work.
It was. Even Brady struggles with that one, but you made it easy.
Alrighty.
Wonderful. Thank you.
You're welcome. Oh,
Yeah, wake
brought
up.
tears to his eyes. It was that good.
No, feels really good.
Awesome.
Do you want me to close it out?
Yeah, sure.
So, Kendra's what? Your preceptor going into trimester 10.
Graduate in December.
Wonderful adjuster. She learned from the best, being us here. And Logan. Logan's a wonderful school. But she's really good with her hands. So if you guys are in the area and you want to get some work done, definitely come into the office. See Kendra. She'll get you feeling good. Otherwise, we'll see you in the next one, guys.
Hello, Baltimore. It's Dr. Jeff Kalkstein with Kalkstein Chiropractic, your Baltimore area chiropractor. And I'm with Alicia this morning. And what is unique about this young lady is, where do you live?
I live in Upper Marlboro.
Upper Marlboro, yeah. So how long did it take you to get from Upper Marlboro to Towson on a good day?
On a good day, an hour.
An hour, okay, all right. And so you first came I've got the history right here. You first came in like 2020.
Yeah.
And what brought you in then?
TMJ.
TMJ, yeah. And did we have good results with that?
Yeah. So if I wouldn't have done this, I went to the dentist. They gave me a mouth guard. They wanted to give me Botox. They wanted to do all these things.
Right.
And at the time, my situation was getting progressively worse. And I mean, I don't need Botox. So.
Yeah. So and she came about 6 or so times, and during that time we did what to help you? We did.
I started off with the adjustments,
Right.
and then that was an instant thing. And then I received acupuncture.
So what you received was trigger point dry needling. We're not acupuncturists, but as chiropractors we can use dry needling to help solve some of the soft tissue issues with a lot of musculoskeletal injuries. And then did we do any soft tissue? Did we do any soft tissues with the muscles around there with our fingers?
Yeah.
Yeah, so we were doing some dry needling, we were doing some soft tissue. So basically what we did was we improved how your jaw was moving, right? And then you came back one other time, and a couple times, 4 times in 21, and I don't remember what that was for, but...
My TMJ was active.
So
so that second time is when you started with the dry needling.
The dry needling, yeah. So what brings you back this time?
Oh, just tore up in a different way. My back, my upper back.
Your upper back, okay, all right. So had you tried anything for the upper back prior to coming here?
No.
You just came straight here. Okay, all right, great. So let's have you face the camera. Go ahead and turn your head. No, you can just look at Carly. Turn your head to the left. Does that bother you at all? No, and turn to the right, all the way as far as you can go. Does that bother you at all? And now bend, look at the ceiling, bend backwards. Does that bother you? And now bring your chin to your chest. Does that bother you?
No, but I can feel that it's very tight.
Up in here and through here?
All the way down there.
Yeah,
It's like,
okay, all right.
like 2 belts.
Yeah, so Alicia came in on, was it on Tuesday? Yeah, so one more thing. Let's have you bend side to side for me. I want to see how you move down there. Yeah, see, that's really good. Now go back the other way. Okay, and go back to the right one more time. And back to the left one more time. Okay, let's have you lie on your left side down and face the mirror that way for me.
Can I say something?
Yes, ma'am.
So when I do this,
Yeah.
all that hurts right up in there.
Yeah.
But when I do this, it doesn't feel as bad.
Yeah, that's why we're taking that side first, because there's a limitation in how you move. That's how we decide what we want to adjust first, no pun intended. So go ahead and lie with your left side down and face the mirror. And lean back in. So what's the significance of those shorts?
At the time when I bought them, probably about 7 years ago, they were on sale.
But you have a Star Wars shirt on, and it looks like a SpongeBob pair of shorts to me, whoever SpongeBob is.
Yeah. No.
And I don't know. I don't know who SpongeBob is. Let me have this on.
Okay. I'm not gonna judge. I am gonna judge. How do you say words that don't know?
SpongeBob?
Yeah.
Well, I think that my grandchildren talk about SpongeBob, I think. So let's get you nice and loose. Take a nice breath in and relax. Let that loose. Very nice, very nice. Go on inside. Is that comfortable?
Yeah, I needed to let that sit in for a second. Okay, that's really good.
So the treatment is an adjustment, but we also did some dry needling up on that upper back, didn't we? Come on over here for me. Like this. So just relax. I'm going to roll you towards me a little bit, okay? Let that loose for me. Beautiful. We should have put a mic on that. That was awesome. On your back for me.
It was awesome.
So now we're going to adjust our hips. Relax your hip. Beautiful. Go ahead and slide back up that way for me.
I was told previously that they were uneven. I don't know how true that is. But
Yeah, I think there are people who have, slide up again, so this one's a little bit more stuck than the other one. So what I want you to do is I want you to hike up your hip towards your shoulder, lift it up towards your shoulder. Nope, like this. Draw it up this way, like that, okay? Now draw. There you go, just like that. Hold that tension. and relax. Just let it loose. I'm just going to give you a little tension on it.
Okay.
No, let go, let go. Now draw it up. There you go, beautiful.
You know what? This feels like I'm holding a fart that I don't have.
Yeah, now go like this. Let it go. Would you relax that? Now let it go. There it goes. So that's a little proprioceptive facilitation to get that to move a little bit. So lift your head up for me, please. And you can slide and put your head at the top of the table.
Okay.
Not so far. Right like that. There you go. She has mid-back pain, and yesterday, see, that's not as tight as it was the other day, but it's still tight. Drop this shoulder. That's beautiful. That's comfortable, isn't it?
Yeah. Interesting.
Yeah. Let's step off and go ahead and face one more time. Now let me see you turn your head to the left as far as you can go and to the right as far as you can go. Yeah. It's beautiful. Go the other way. Oh, that's really good. Now bring your chin to your chest. Has that changed out at all?
Yeah, there's no more tension.
No more tension, yeah. So we're going to go out into the hallway, and I'm going to use that technique that I did the other day where I push down in here, right? Mm-hmm. Yeah, so let's go ahead and do that again. We won't go the hallway. On your tummy. Do you work out? No?
My idea of working out, I walk a lot.
You walk a lot. It's probably one of the best activities you can do. And go ahead and slide up for me a little bit. All the way up. Yeah, now relax your arms down. I think when we talk to people, young people, they're not quite there for the most part, but we talk about living better longer, right? And there's different components of that. One of those is movement. And the way we take movement, we divide it into two categories: cardiovascular fitness and strength training. So you're never too young to start on a program like that. And walking can be an introduction into the cardiovascular fitness, especially if you walk for 45 minutes or so. See, this area, what we're doing is we're walking up her spine in each segment at a time, and I'm looking for those areas that are not moving properly, and there it is right there. That's stuck, if you will. So take a deep breath in, breathe all the way out, let it loose. Okay. Was that uncomfortable?
No.
Let's stand up now. I'll do one more thing. See you bring your chin to your chest for me again. How's that now feel compared to when you first checked it?
Much better.
Much better.
Even the last time, I felt some weird pain at the center. I don't feel that.
Feel it right now? Yeah, okay. Okay, so what we're going to do now is we're going to go dry needle, and we actually put class 4 laser on there, which I think is really a powerful tool for this kind of condition. Okay, so anything else you want to share with everybody out there?
Get it together.
Yeah, good. Thank you, Baltimore. Carly, if they like this, what do they do?
Subscribe.
Subscribe. And if you're having any pain between your shoulder blades, give us a call at 410-296-7700.
There you go.
How am I doing with that, Carly?
Getting better.
Better. Thank you, Baltimore.
With the MRI that I picked up on you, and that you brought in, I should say, you have a history of spraining this ankle. Where does that come from? Is it sports, running?
15 years ago, had an accident sled riding.
Sled riding?
Yeah.
That was where you had some significant trauma to the foot itself? A couple ligament tears that are, like, we'll call them historic. They've been there, if you will, right? So do you ever get pain in any of these areas here with your foot, or is it mostly on the back side?
It's the side there and the back.
Side here? Yeah. Okay. So you have a little stress response in the bone and the ligament over in this area on the MRI itself. I don't know if you read that, but so it'll be helpful to get a little bit of work done through here too. Have you ever worn a boot?
Do you mean Like a cowboy boot, or do you mean like literally a
Well, you
walking
know
boot?
what? Now that you bring it up,
Because yes.
you ever been to Stampede in
That's
Calgary
actually my
before?
primary,
His boots?
yeah.
Okay.
But no, I've had the thing where you sleep in it and then the walking boot thing.
Gotcha. The motor cares. We're gonna start with Shockwave here. I feel like I'm not getting quick response within the next 3-4 weeks. I might do a referral in-house to Carolyn. Carolyn's our integrative medicine medical provider. She does PRP injections. PRP can be really beneficial for this type of problem without having to use a steroid. And it's basically taking your own blood platelets, you spin them, you take the good stuff out, and where you have small tears like this, it can be healing for that tissue. It can help regenerate that tear, okay? And so can Shockwave, so we're gonna lean into that for a little bit, but you might be a really good candidate for PRP, and we can evaluate that in a month from now, okay? I don't think you need a boot. But you will use one after if you get PRP. That's the only time. Okay. Point your toes down towards me. Cowboy boots, huh?
For years.
For years. You from Baltimore?
I am actually.
Okay. That's like, that will be a first for me. Someone from Baltimore wearing cowboy boots.
All the time.
Point down towards me. I went to San Antonio, Texas. That's about as cowboy as I've gone in the last couple of years. And bring your toes back up. But I want to go to Calgary and go to Stampede again next year.
Oh yeah.
Have you ever been up that way?
No.
That's a really cool area. Good. Point down for me. Good. A little pressure through tib anterior over the mortise joint. I'm working on the, it's called the ATFL ligament, anterior talofibular ligament. Right in this area here, that's where he's got a little stress response. Right. So just ischemic compression, pin and stretch, working through this tissue. This is an ART protocol for it. This will help it feel better and move better. Okay, go ahead and pull your toes back. I want to work adjacent to the Achilles tendon here. Go ahead and push your foot into me. How was PT?
It's good.
Good. All right, and then back up. Point at me. So we got, this is our second visit. We have had shockwave, radial shockwave, focus shockwave, ART. We're gonna do some adjustments here. Done about 15 minutes of PT. And then you're gonna add a YouTube video to boot. It's all in a day's work, baby.
Yeah.
Let's go. Point down at me. And then come back up. And I should probably stop doing these foot videos because I have like 6 ankle Achilles tendon patients right now. I'm gonna be marketing myself as the foot doctor in Baltimore pretty soon. I'm okay with it. I wanna help people. Bring your toes back. Good, and point down. And relax. So, you're not gonna give me any info where the cowboy boots come from?
It's just families from Virginia. We've always sort of done it. So
Virginia is like northeast, but it tries to pretend like it's southern.
No.
South of the Mason-Dixon line.
That's
Yeah, I know.
exactly
It's farm country out there. I get it. Man, it's pretty.
You go out to near Charlottesville in that area. I love it out there. My sister went to school at UVA, and I was like a senior and then freshman in college, and I would go and visit, and she'd take me out. It was like the best time. I had a Jeep Wrangler. I was driving out there like every other weekend, coming out to visit her and her friends. It was awesome.
Good people. You're gonna feel a little release here, okay? Just like that, okay? But a little quicker for me. Good. No pressure in the knee. It's good. Virginia, huh? There it is. Alright. Let's go 2 for 2, man. Let's make this happen. Raise the table up, do the stretches in between the sessions. Yep. I'll see you next week a couple times, okay?
Yep.
Hey, thanks for watching.